Watching Hindustan Times, and I'm Aditi Prasad. The COVID-19 positive cases in India are on the rise. As of this morning, we have crossed the 17,000 positive cases mark. Of course, the number of cases and the rate of growth in cases is, of course, slowing down. While the actual number of cases are rising, the rate of growth in the number of cases seems to be slowing down, according to some experts, lending credence to the talk that India might be seeing a less virulent strain of the virus. If so, is it time to now start focusing on livelihoods apart from lives? I'm joined by senior fellow of Brookings Institution, Shamika Ravi, who has also been a former member of the Prime Minister's Economic Advisory Council. Thank you, Shamika, for joining us today. So Shamika, I would like to start with you on you're doing these daily trackings. You wrote that the growth rate of India's cases is declining consistently. Can you take us through the numbers? Is there reason to start cheering just a little bit?
If you see the increase at the early stages, we were growing quite fast. There was a time when we were doubling every 3 days. And of course, since then, you have had a series of policies getting enacted at the central level as well as the states. I think the early quarantining, airlifting of passengers, keeping them separate, the whole isolation, the contact tracing did manage to contain the early spread. But then, of course, the lockdown was the biggest national sort of policy intervention we have had as far as arresting this growth. And if you see, the impact of that has been felt since the 6th of April, because the nature of this virus is such that it has an incubation period of about 2 weeks.
Yeah.
And if you see the numbers from the 23rd, 25th of March, 2 weeks from then, so 6th of April is when you see a relative flattening, which means that the rate of growth, it's important to realize we are still in a growth phase, which means that the overall cumulative numbers of
Right.
confirmed cases are of course rising. But it's important to look at how many active cases and new cases are there. And overall, you see that the total cases are increasing, but at a decreasing rate. In fact, yesterday, in over a week, we were doubling every 11 days, and that was the slowest we've had. Now we are doubling every 10 days. If you look at the moving averages, which is a good way to look at it, if you look at the compound daily growth rate, these basically reduce the noisiness of the day-to-day data. It's
Right.
important to look at statistics which is less noisy. And these trends are telling us that on the whole, we seem to be managing things quite well.
What about Maharashtra and Gujarat, the two states? They are seeing, but contrary to the rest of India, where there seems to be the beginning of a flattening of the curve. Maharashtra and Gujarat they seem to have bucked that trend.
These are all early numbers, Aditi, and it's important to note that almost all the statistics we calculate at the national level that we have been tracking for the last several weeks now.
Right.
These are based on Johns Hopkins data, which means it's verified, it's all released at the same time. The state level analysis that we started to do about a week back is based on the crowdsourced data that is available. And it's important to see exactly how they aggregate these numbers. So there are issues with that data. I think that's important to note because it's crowdsourced. The timing of the state reports will make a difference. But on the whole, it's important to note that there are enormous statewide variations. And of course, it has to do with the fact that some populations are more susceptible simply because, those are places from where international travel happens a great deal. The contact tracing, I think, since have perhaps not been of as effective and of the nature that we have seen elsewhere. Well, if you look at the overall, the severity of the hotspots, then naturally so far it has been Mumbai and Delhi. So Maharashtra and Delhi that have been contributing the largest number. But lately, we are seeing numbers increase in Gujarat as well.
Okay.
In fact, over the last several days, Delhi has managed to reverse the trend. Now, of course, remember, these are, again, you have to see these over several days because these are really tracking statistics.
Right.
And sometimes all you need is one congregation or nothing of one, case, which might have very large network effects.
Yeah, a
But
super
as of
spreader.
now,
Yeah.
it's quite clear that Maharashtra and Gujarat, the way the numbers are increasing, gives me a sense that the nature of the confinement that the two states are carrying out have not been effective. And I think they really do need to do a better job of it.
Kerala, for instance, let me talk about Kerala today. The lockdown restrictions have been eased considerably in Kerala as of today. Uh, do you think Kerala is being a little hasty in easing the lockdown restrictions, or do you think maybe right now is the time to start looking at the livelihood aspect as well as moving on from the lives aspect?
I think it's important to understand that these decisions, the more localized they are, and the greater the state capacity to arrest this outbreak, the more faith I think we should have in local leadership.
Right.
And the reason I say that is because, we have been studying some of the initiatives taken by, the Kerala government in Kasargod. Because Kasargod, if you recall a month back, it was one of the early hotspots.
Right.
When there was one gentleman who flew in from the Middle East and subsequently attended, gatherings and football matches, etc. There was a great fear because the way the numbers began to increase, there was great fear that the contagion could have spread far more. But I think, Kasargod as of last 4 days have had 0 new cases. Right? And this seems to suggest, if you just look at the moving average of the new cases, it tells you that they have quite successfully arrested, the outbreak. Now, it hasn't happened overnight, and that's why I think it's important to realize what are the different steps that have been taken. And I think what we see very clearly from this case study is that they have used the police force. Now, remember, it is a health outbreak, but a lot of this is really just law enforcement.
Right.
When you invoke the Epidemics and the Disease Act, the state gets certain powers. You're able to confine and restrict people's movements, and enforcing that becomes very important. And without the police, I think, only left to civil administration or perhaps health workers, even less. So I would imagine enforcement becomes a serious challenge. And then the exact set of steps that the police of Kasargod took, I think it's quite insightful. They went from not just doing acute contact tracing to tracking, actually tagging people, getting policemen to basically go and be around the primary and the secondary contacts in order to make sure that restriction was contained. Then preparing for possibility of the outbreak going out of control, which means there was a plan B that was also enacted. You just have to look at the series of steps that were taken to understand the level of planning and effective implementation that has to go into confinement strategy. And that, frankly, we have to do this at every district level today in order to truly break the sort of back of this outbreak. And definitely in the 170 hotspot districts that have been identified by the government of India.
Partial lifting of the lockdown. I won't call it lifting, but a relaxation of the norms as far as the lockdown is concerned. Do you think that's a step in the right direction, given the stage of the outbreak that India is in?
Well, partial lifting of the lockdown, I think, is very important, Aditi, and we are moving towards that direction. If you recall the Prime Minister's the last speech to the nation, when he said that from the 20th onwards, we will try and see how to calibrate and ease some of the restrictions because, first of all, it's important to realize that the opportunity cost of such a big lockdown is enormous, and not just on livelihoods, the way people think of economy. These kind of restricted movements have opportunity costs both for life and livelihood. So I think lifting in a very calibrated, responsible way is the only way to move forward for a country like ours.
The restrictions lifting, of course, today is the 20th of April. Some restrictions have been lifted. As far as livelihoods are concerned, as far as getting back onto the economic activity for the country is concerned, because you've also been a member of the Prime Minister's Economic Advisory Council. What do you think should be the next steps from here on?
Well, I think, when we say calibration, basically it means that if we have identified the hotspots, then clearly the hotspots require the kind of confinement and containment strategy that we have in place. And of course, even those places, it can be relaxed in terms of the essential, expanding the list of essential services itself. But in the rest of the country, there is, India is a very large country. And beyond the hotspots, we know that there are approximately 320 districts which are so far untouched. Now, to say that with certain degree of certainty also means we have to test for community spread to be able to say that these are indeed untouched, but we can do that. The rate at which, if you're seeing the testing increase in India, it has been quite, good. It has been quite satisfactory. So extending the testing to community spread will mean that the other, 325 districts can really go back to life as normal. Now, clearly, given the interdependence across districts, movement of people, goods, services, interdependence across states, we are not going to be back to 100% of our potential, just given the interdependence. Still, the entire country is really COVID-free. But it will mean a lot if, in an informed way, we begin to lift this lockdown in at least those places which seem to be unaffected. Now, then you have the middle chunk where there are some cases, but they're really not, escalating the way they are in the hotspots. And again, in those places, effective containment strategies, and that's why I think Kasargod initiative becomes interesting, or perhaps even look at what they did in Bhilwara example. But one thing is very clear, Aditi, that it is very much a law and order situation as well. Police have to be a part of the containment strategy. It is a public health outbreak, but given that there are serious negative externalities for others around you, and obviously for the economy, not just your local economy overall, I think it requires a heightened sense of public responsibility. And I think that's where effective containment will require local administration to really mobilize all the manpower that is available with local administration.
So thank you so much, Shamika, for speaking with us. So effective containment, of course, it's a health situation, but what Shamika is telling us that it's also as much as a law and order situation, because law and order has to be enforced to control and contain this outbreak. And moving forward, I think each of the states are, of course, moving into that direction. Let's hope that the things settle down soon, that we are able to contain in most of the areas which are still, reeling under the outbreak. We'll keep coming back to you with more. Keep watching HindustanTimes.com.